So after we finish getting the vitals, we put them in the system. And
Deborah
everybody's
Wynn is a
out the
CTA
way
at
I feel.
university hospitals, which stands for Certified Technical Assistant, like a nurse's aide. But for a long time, she owned a hair salon, and then she got a real estate license. But these jobs weren't enough.
I was looking for a career just to retire in, and I found that the healthcare industry was the only field that I've seen that didn't take a downturn.
A friend told Wynn about a program administered through Towards Employment, an organization helping people find and keep work and helping companies find workers.
And it was a 2-week program, and it wasn't a guarantee. I didn't believe it, especially at my age, and it worked.
Wynn is now 59 years old and sings the praises of a 2-year program called WorkAdvance. The program helped with resume writing, training, career planning, and more.
Good morning, Mr. Stanley. How are you?
The goal was to link employees with growth industries for our region, manufacturing, and in the case of Wynn, healthcare.
I needed Towards Employment so bad. Doing it on my own, I had tried for almost 3 years. So there was no way. I was putting in application after application and nothing worked. With them, as soon as I went in 2 weeks, I had a job.
The way Wynn came into healthcare is a shift in how job placement has worked. Before, the focus was on the short view.
Very often, you need money in your pocket, you need a job. And so you're focusing on what's the shortest route to that without thinking about how certain steps might position you for a bigger jump down the road. And from the workforce system side, the way funding is structured, very often the emphasis on the funding and performance measures was how many people got a job, how quickly.
Northeast Ohio was one of a handful of regions to use the WorkAdvance model that Deborah Wynn at UH benefited from, funded in part by a federal grant and local stakeholders. Employers explained what they needed, and employees were trained and supported in finding a new career.
If we are thinking long term, what's best for the individual and for our companies is to take this longer perspective and really help people navigate a career pathway over the long term. It's really a win for everybody.
The WorkAdvance pilot program spent 2 years providing services to some job seekers and keeping tabs on some who did not receive them for comparison. The findings were promising. Participants earned 14% more than those not in the program, and later participants saw even more efficient gains, earning 22% more than non-participants. The program also saw benefits for people facing additional employment barriers.
50% of the people who came through our manufacturing track had some criminal justice involvement. And also what we found in terms of when we look at results, and we look at how different demographics performed with the model, that once you entered the program, those with criminal backgrounds got jobs and advanced at the same rate as those who didn't.
To some degree, a program like WorkAdvance seems obvious. Workers are trained and supported in a way that employers need. So why isn't it happening already? WorkAdvance acted like an umbrella program to unite services available that workers may not know about. Bethia Burke is with the Fund for Our Economic Future, which helped bring and fund WorkAdvance in Northeast Ohio.
If we think about how an individual might experience getting workforce services today, they have to go to a lot of different places and get connected to a number of different resources. So it's sort of like a disorganized potluck. They're not sure if they're going to get all the things they need and if they're going to connect together well. What WorkAdvance did was brought together a number of these pieces and made sure people had access to the right things at the right time.
The WorkAdvance program as carried out was just a pilot to prove the concept of targeting workers at the employers who need them. And now there is data to show the model works and could prompt new ways to think about how we train workers in the future. Part of the disconnect in training and careers lies in the past ways of how the U.S. has thought of the workforce, says Mark Muro, a senior fellow at the Brookings Institution whose focus includes labor.
Frequently, industry has viewed the preparation of workers as somebody else's responsibility. Meanwhile, the training infrastructure has often pursued a kind of social services model and hasn't really looked very carefully at the job market that it was serving, and that has not led to good results.
Muro says a hallmark of the best solutions involves a deep collaboration between employers and the training system to find workers' careers. It's this kind of collaboration under WorkAdvance that helped Joseph Montgomery find his place at Swagelok, an Ohio manufacturer of valves, fittings, and more. He had spent time in retail, ran a Radio Shack, and even did well selling cars for a time, but then he retrained.
One of the things that WorkAdvance did is they, the company that funds them, they have a tuition scholarship. With the company Swagelok I'm partnered with at Cuyahoga Community College, they have a program called the Right Skills Now. And they funded 75% of my tuition to go there. So that after I finished that, I went in as a level 2 instead of a level 1. Okay. So I started off with a higher wage, and the advancement the potential is huge.
Montgomery now crafts components for Swagelok, and both he and Deborah Wynn at University Hospitals want more people to know about the WorkAdvance program and how it helped them find a career and a bit more stability.
Add more. Give people a chance to get jobs. They talk about they want to help people with jobs. Set up programs that'll help them, because a lot of people don't even know where to start. Let the word get out.